We're pleased to be joined by Trish O'Keefe, who's president of Morristown Medical Center and vice president and chief nursing executive at Atlantic Health System. Good to see you, Trish.
Good to see you, Steve.
I want to make it clear you have, in fact, a very deep nursing background and history. Talk about that.
Sure. I came to Morristown Medical Center as a graduate nurse out of Wilkes. Advanced my career going back to Seton Hall for my nursing administration, and then followed suit at Seton Hall for my Ph.D. So very proud of my nursing background.
Let me ask you, and by the way, Atlantic Health is one of the health care organizations that are supportive of what we do as underwriters in the area of public health issues. Trish, let me ask you, as a nurse who's seen it from every perspective, I'm curious about this. What impact do you believe COVID has had? We're 12, 13, 14 months. This is be seen after that into this pandemic. What impact has this had on nursing and nurses and nursing?
Mm-hmm. Yeah, a great deal of impact on nursing. It truly has shown the resilience of our profession, focusing on the patient, the family. It was always a can-do attitude from every nurse, our seasoned nurses, our young nurses that just came out of school. And it was always, we will do that job. We will care for that patient. It was always such a positive response. So again, very proud of the profession and how they responded to this pandemic.
Are you confident that there will be more people, qualified, top-level caring people going into the profession of nursing, or fewer?
I think more. I think how we have seen the evolution from a healthcare perspective, they want to give back to their community, and by giving back is working in a healthcare profession, whether they're nurses, allied health, going back to be a physician as well too. So we've seen a real outpouring of how can I go back to school? How can I help our healthcare in general? So yes, I think a positive move.
When it comes to, and we're doing a lot of programming around vaccine awareness, distribution, rollout, et cetera. I don't know what the exact numbers are, but I know that between 90 and 95% of physicians have taken the vaccine or willing to take the vaccine. Mm-hmm. Is the number lower than that for nurses? Mm-hmm.
The number's evolving right now. We have seen, say, for an Atlantic Health perspective, we are in the mid-60s and higher. We are continuing to educate our young staff in regards to the benefit of the vaccine. As you know, we have a vulnerable population as well, and a child rearing population as well too, that are asking a lot of questions of the OB and
Good questions, legitimate questions. I'm sorry for interrupting, Trish. These are important questions.
Sure, very important questions. So, it has been our focus since the beginning of the vaccinations evolving to educate all of our population of the benefits. We know vaccines save lives. We know that. So how do we educate people in understanding how it may impact them positively, and really educating them on the benefits of the vaccine and what their concerns are? We do have very vulnerable populations out there in our community, so we are reaching out to educate.
By the way, if people want to find out what's going on every day in New Jersey in terms of the vaccine distribution and where we are, where we're not, check out NJ Spotlight News, and also on the New York side, well, both shows are in the region. Tri-State region is Metro Focus. But I want to follow up on something. When it comes to public health, you've been involved in public health for a long time. What do you believe, Trish, the long-term impact and the implications will be for public health based on what we've experienced with COVID to date? How will it change? Mm-hmm.
I think people will be advancing the benefits of public health from an education, early detection, early treatment, prevention. We've been, as a society, focused on acute care, but we need to be focusing on the prevention and early detection efforts, getting to your primary care as quickly as you possibly can, the routine checkups that are needed. So I'm pleased to see an advancement in many of those areas, as well as the technology. We've seen such advancement, e-visits, telehealth has expanded a great deal during this pandemic, and very positively. So we're reaching people we never reached before.
Trish, do you believe, you mentioned you actually jumped ahead of where I want to go, which is really good. Do you believe that telehealth will expand over time? And if so, where does it, quote, work and is effective? And where should people see their physician or their healthcare professional directly and personally, face to face?
Yeah, no, definitely. Clearly, from the primary care standpoint, telehealth has worked a great deal. And even looking at different technology, from tracking patients' blood pressures, tracking weight, compliance efforts in the telehealth space has been very positive. But if things start evolving or more acutely ill, it is good to have that face-to-face and that meeting, whether it's in a physician office, in the emergency department, if more acutely ill, to see that physician and that team.
Before I let you go, more and more nursing professionals becoming leaders, CEOs, presidents of hospitals, correct?
Yes.
And it's good, that trend's going to continue, isn't it?
Yes, it is. Yes, it is, Steve. And glad to see.
And that's a good thing.
And that's a great thing. And that's a great thing. Yeah, that's a great thing.
Yeah, Trish O'Keefe has a Ph.D. in the exact field. Trish, it is what?
It was in nursing research, nursing administration.
Also an RN, president of Morristown Medical Center and vice president of chief nurse executive, I'll get that right, at Atlantic Health. I want to thank you so much for joining us, Trish. All the best.
Thank you, Steve, very much.
And by the way, thank you for what you and your colleagues in the healthcare world are doing every day on the front lines. I'm Steve Adubato. That is Trish O'Keefe. Thanks for joining us. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by TD Bank, Johnson & Johnson, Summit Health, NJM Insurance Group, New Jersey Sharing Network, Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, United Airlines, and by Operating Engineers, Local 825. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Monthly.
I'm Miles, and this is what I work for. To be my best for them and for me, in body and in mind. I need a health insurer that helps me get the care I need for both. That has mental health professionals that I can talk to when I need to. Because when I feel strong and secure, so do they. This is my life. And this is how Horizon Blue Cross Blue Shield of New Jersey works for me.